Good morning, everyone. Welcome to the Dairy Leaders of Tomorrow virtual farm tour. I am Brittany, and we are so excited that you are joining us today as we not only get to tour a dairy farm, but also explore careers in the dairy industry by meeting a few dairy professionals who work with our dairy farmers. First, for everyone that is new to the Dairy Leaders of Tomorrow program, this is provided by the Dairy Excellence Foundation in Harrisburg, Pennsylvania, and is available to students and teachers across the country. The Dairy Leaders of Tomorrow program is a comprehensive program designed specifically to prepare high school students to pursue careers in the dairy industry. Using a three-part model, Dairy Leaders of Tomorrow offers a classroom curriculum, scholarships for educators and students, and on-farm experiences like this virtual tour today. We welcome you to check out the website at www.dairyleadersoftomorrow.com. And if our backup team can help us get that in the chat feature for everyone watching, that would be great. So again, that's www.dairyleadersoftomorrow.com. You can go there to learn more about the program and see if the curriculum would be a good fit for your classroom. Next, as everyone continues to join us live today, you will see that chat feature is enabled. So please feel free to use that chat feature to comment or ask questions throughout the tour. We really are excited to hear your questions, and our farmers and our professionals are really happy to answer. And before we jump to getting an introduction here, I just wanted to see who is joining us today. So it looks like we've got some folks from Ringgold South. Hello, everybody. We've got a 5th grade class from upstate South Carolina. Welcome to our tour today. We have Bryan High School in Bryan, Ohio. Welcome, everyone. Thank you so much for joining us today. We are excited to have you. We have some really great people we're going to be sharing with you today and an awesome farm tour. So thank you so much for joining us. If you're hopping on just now, go ahead and let us know in that chat feature who you are, where you're joining us from, and you can continue using that chat to go ahead and ask us questions as we go throughout our tour. So this morning, we are visiting a dairy farm in the southeast region of Pennsylvania called Marshak Dairy. Marshak Dairy is a dairy farm on the University of Pennsylvania campus. It was actually built in 1996, and Marshak Dairy is named in honor of Robert Marshak, the 9th Dean of the School of Veterinary Medicine, whose support was instrumental in establishing this farm. The greenhouse design of Marshak Dairy uses natural lighting and excellent ventilation within the farm to promote a healthy environment for these wonderful cows we're going to get to meet today. The Marshak Dairy provides an easily accessible working dairy farm for research trials. In addition, the dairy serves as a laboratory for teaching students on topics related to cow healthcare, preventative medicine, nutrition, and even food safety. Professors Joseph Bender and Linda Baker work with students at Marshak Dairy on research projects largely focused on nutrition, environmental sustainability, mastitis, and cow comfort. So we are really excited to get this farm tour ready for you. And we're going to go ahead and see if our Farm Cam 1 is ready to begin our tour. Let's see if we can get them on here. Hello, Joe. Are you there with us?
I am, Brittany. Great. Hey, thanks for the introduction. Really appreciate everyone joining, and certainly appreciate the Dairy Leaders of Tomorrow tour and also the Center for Dairy Excellence for putting this together. They're really excited to have an energetic and large group of students here at the Marshak Dairy. We're in Beaufort, Chester County. It's a nice, cool fall morning. So everyone has sweatshirts on, and when the sweatshirts are on, that means the cows are comfortable. It's just a perfect morning to get together and talk about careers in agriculture and specifically dairy this morning. So looking forward to spending some time together, both virtually and in person here for the folks that made it to the farm.
Yeah, so we're excited to have you, Joe, and we're looking forward to taking this tour with you. So I will let you guys take it away if you're ready to go.
Great, thank you. So we're going to meet up with our group over here. Just a second.
All right, so as they're getting the group ready, just wanted to give a little bit more about Joe, just to kick this off. So Joseph Bender is the assistant professor of dairy production medicine at the University of Pennsylvania Veterinary Medicine. So we are excited to have him, and as he's
our group?
We have a group live as well. So we're excited to have our live folks and those who are joining us virtually. So Joe, whenever you're ready to start the tour, go for it.
Okay, I think we're going to go ahead and get started. So, hey, good morning, everyone. Here, I've been introduced virtually already, but my name is Dr. Joe Bender. I'm a veterinarian here at the University of Pennsylvania in the veterinary school. I work just off campus most of the time. I, in particular, do consulting to farmers across the state of Pennsylvania. So I see a lot of different shirts. I recognize most of the area where you've been from. So just to start, who here has a dairy background? So we got a couple hands up. Yeah, so familiar with some cows. So we're going to take a little walk. So the first station here that we're going to look at is just kind of a farm tour and a basic overall history. And what we really want to focus on this morning is just opportunities for you to get involved in agriculture and dairy. So we'll go ahead and start walking this way. And I think one of the things I would ask you to be thinking about as you're doing this today, we're going to see a lot of different aspects of the dairy, and we're going to talk about the life cycle, like what happens to an animal on the farm. And then every point in the life cycle of an animal on the farm, there's opportunities to get involved. So if you like, mature, larger animals, like you can kind of see over our shoulders here, there's tremendous opportunity to be engaged there. If you like the calves, there's lots of opportunities there. So let's take a walk into our main dairy barn to start with. It's a good place to kind of kick off and see what we're looking at. And then come on in. The cows will be glad to see you.
Oh, they look so cute.
So this is our Marshak Dairy. It's named in honor of Dean Robert Marshak. This dairy was built in 1996. So we're just getting ready for our 25th anniversary. So just a couple things you'll notice right to start. It is a greenhouse facility. So if you take a peek up and think about where you go and buy your plants over the weekend or for your mother for Mother's Day, however it works, very similar setups. We get a lot of natural light. And we use a lot of natural ventilation also. So we're in southeast Pennsylvania, so it does get warm a fair amount. So really April through September, we have to really focus on keeping the cows cool. So you'll see above them, they have the misters that come on and spray water on top of the cows. And then also the fan. So it's kind of like an amusement park. Get water. Stop back and look at the barn. The animals are broken into 4 groups. And it's based on how much milk they're giving, how old they are. And those are really the 2 basic criteria, and then kind of where they are in their lactation cycle. And we do that for a couple reasons. So animals that have had calves most recently have different energy and protein requirements. So we can feed those animals differently. If you just step back and look at the cows eating, so they were fed here just maybe half hour ago. And you think about how a cow spends her day, they spend about 4 to 5 hours a day eating. All right, not a bad gig, really, when you think about it. So they'll come up to this feed bunk and eat about 8 to 12 times a day. It varies a little bit. And how much they eat is directly related to how much milk they give. So those of you that are interested in milk production or working with animals, troubleshooting on farms, just about anything you do on the farm should be focused around how the cow spends her day and how much they eat. So it's a huge opportunity. So one of the stations we have that you're going to go to next is specifically geared towards looking at the nutrition. So any questions so far? Feel free to holler out. The cows here are awfully friendly. I see some folks out, petting them. So Marshak Dairy, there's 160 cows in here. It would be more like a traditional dairy. We do sell our milk to a milk co-op, but at the same time, the cows here are used specifically for teaching veterinary students. So really, they're fairly easy to work with, fairly docile, nice to get along with. Cows in general are. So they're taking their time eating here, which is really how we like them to spend their day. So the normal day for a cow is 4 to 5 hours eating feed. They spend about an hour drinking water. The cows here are milked 2 times a day. So they spend about 2 hours, to and from the milking parlor, and the other 14 hours or so, you have to check my math, is spent resting, laying down. So yeah, if you think about your Saturday, how you like to spend it, sleep around on the couch for a while, get up, get something to eat, take a little nap in the afternoon, get some supper, take a little nap before you go to bed, take the edge off, that type. That's really, we try to do anything we can to not interfere with that normal, how the cow likes to spend her day. Okay. As you kind of look at the facility here, you'll notice how hard it slopes to the center. So it's about a 3% grade, and that's because we actually recycle water on the dairy. You'll see some of this afternoon when you go to the other farm. But water comes and floods and actually washes all the manure to the center, and then it's recycled. So just dairy in general, we use about 60% less water to make a gallon of milk than we used back in 1980. It's unbelievably efficient. There's very few industries outside of dairy that can make those type of claims for how efficient the system is. And really everything we've done here is kind of in the name of efficiency and sustainability. Any questions on the adult cow barn? How much do you think a cow weighs? Give me a guess. How much do you think a cow weighs? 500 pounds? You're close. Add 1,000 to it. So round up a little bit, right? Yeah. So about 1,500 to 1,700 pounds will kind of be your average cow in here. They eat 100 pounds of feed per day, roughly, give or take, and drink 25 to 30 gallons of water. Then, of course, you have the manure associated with that. So, okay, so that's our mature cow pen. So a cow will have a calf. They'll come into this barn. They milk for roughly 300 days if everything goes right. And then we give them a little break where they don't milk for about 60 days, and then they'll have another calf. After they're born, it takes them about 2 years to get into this barn after they've had a calf. All right, and the average cow in the United States has about 2.5 calves. That's the average. So most cows are in the herd somewhere between 5 and 6 years. So it's not short, but yeah, fair amount of time. So let's walk around the edge of the barn here. I think we have a few more minutes, and we'll take a look at kind of where things start. So the building that you're looking at just across the driveway, this is where the dry cows are, and that's also where they go to have their calves. So when they're not milking in that 60 days, really the last trimester, when they're getting ready, to have their calf, they're fed a separate diet over there. It has more protein in it and less energy in it. It's really similar to humans, what we try to emulate in human medicine and human nutrition. So those animals are over there. Then they have individual pens they go to have their calves in. So you'll see that when you go over. That's our veterinary station that you'll see. So there's veterinary students and some field service veterinarians that'll be get to do a pretend physical exam on a cow, but it's not that pretend. You'll be touching the cow. So as we walk around the side here, you'll see some of the big tanks that are up in the corners. That holds the recycled water from the farm that gets used to flush down through the cows. And you'll have an opportunity here just to sneak back and look inside the barn. So kind of like I said before, we really want cows to be doing 3 things: either laying down, taking a nap, eating, or drinking. In general, cows just don't stand around. And if we give them more time to lay down, be more comfortable, they ultimately give more milk. And that's probably been one of the biggest things we found in the dairy since when I was a kid. If you give cows the opportunity to just spend the day how they want to, they will produce more milk. So do you know how much more, well, let me ask it a different way. Compared to 1980, when I was born, cows give, almost about 35 to 40% more milk than when they did. And it's because of advancements we've made with housing and cow comfort to kind of stimulate more milk production. So let's walk around this side here. and this is kind of where everything begins. We have a couple different stops for the calves to make. So calves are born, and then on our farm here on the Marshak Dairy, they're placed into an individual calf hutch. We can walk down and be a little closer. Wait till everybody filters down here. These are the cute ones. These are the ones you want to get close to. So after they're born, the majority of calves here actually go into an individual hutch like you see here. And there's a couple reasons for that. The biggest reason is biosecurity and just keeping the animal healthy. So the calf is with the cow after they're born for a small amount of time until the cow goes into the herd. But we take the calf away within about an hour, 2 hours. And that's basically for the safety of the calf. Cows are big, they step around, and we actually, the calves aren't born into a completely clean environment. So we do try to get them into an individual hutch. So they're in these individual hutches for, it really depends, about 6 to 8 weeks. It varies on every dairy farm. And I think maybe one of the easiest ways to describe it, if you were growing up, or I have a toddler at home and he goes to daycare, and about the worst, oh my gosh, he comes home every other week with a cold or some type of snotty nose. And we're trying to prevent that type of situation in our baby calves. You will see, and this is kind of becoming a little bit more mainstream, the larger hutches in the back, you will see groups of animals, and there's 2 calves to a pen. So we're doing some work. We've improved biosecurity enough and cleanliness on a lot of dairy farms that we're able to do some of these some group housing. Okay, we've figured out how to keep things a little bit cleaner, how to take better care of our animals, so they can actually, for lack of a better term, use the buddy system. So the animals that are kept in an individual hutch, they're only in there for about 6 to 8 weeks. And then they take a step up to some of the pens that you'll see behind us. They go into a group of 3 or 4. And the point of that is the 2 most stressful times for a calf is, one, when we're taking them off milk and they're going to a solid diet, and also when they get grouped. When they go from being a single to a group of 3 or 4, it can be very stressful for them. There's a lot of work that's done in the calves, because we know that how calves are taken care of, particularly when they're newborns, really impacts their future productivity. Everything from the housing to the nutrition, vaccinations, etc., has a large impact on their future productivity. So if you have some type of interest in calves, there's a lot of industry jobs, veterinary jobs, just managing calves on dairy farms. It's a huge opportunity to get involved in the dairy industry and following this cycle. So, and this part's extremely important, because on dairy farms, the number 2, usually the number 3 reason, or excuse me, most expensive thing is replacement animals. So we're trying to keep a flow of animals coming into the herd. So yeah, good time. Go ahead and walk around the calves a little bit. The manure storage is off. It'll be over your right-hand shoulder down there. So you can see they all have an individual number, has their birth date on it. Oh, there you go. Yeah. You got her excited. So these will be be a little careful with them licking your fingers. I don't know if we have somewhere for you to wash your hands. But yeah, very friendly. Now what you have to do is figure out how to sneak one of these on the bus for the way home. Oh, you've already got it figured out? We'll have to check your pockets before you leave. I think they'll notice. So one thing about, they are all females. Okay, so there aren't any males, there aren't any bulls that are kept on the farm, or males, and that's for mostly safety reasons. But then the females obviously make the milk, so that's who we want to keep on the farm. So yeah, this is the future of our herd, and that's kind of the way we need to think about it when we take care of the animals.
Awesome. They are so cute, Joe. We are loving this on virtual as well. And I know you said about the bus and taking you on the bus, but we wish we could take it virtually too, and take them through the screen here and get to hang out with them. But
Yeah, yeah.
it's been a lot of fun. Thank you for letting showing us around a little bit. And
Sure.
these calves are super cute. I do have, if there's any questions online, we gladly take them. And I just wanted to ask how we're doing on time on your end. Do you know how much time we have until they start switching, or
I think we're getting very close to the switch if my watch is right. So I'm gonna have to try to get them away from the calves, which won't be easy. But yeah, I think we're probably up against our group switch. So
Sounds good.
any questions from anybody in the group about the calves? So it is. Yeah. Yep. Yeah. And then between every calf, these are lifted up. Everything's cleaned out. They're power washed. They're sanitized, set back down. The mats are so just it's easier to keep clean. Yes, there is. Yeah, yeah. Because of the stones. The stones are the easiest thing for us to manage to keep the calves on, because we can replace the stones over time. Yeah. So, whoops. Oh, sure.
All right. So, Joe, I'm thinking maybe that group has left. We did have a question for you. If you're able to answer it for us. I know we're at a farm that's, part of research and really part of helping, improve the dairy industry. We were just wondering what inspired you to come to UPenn and Marshak Dairy? Like what drove you to come here instead of like running your own farm or anything like that? What brought you to Marshak Dairy?
Yeah, sure. And that's actually, yeah. I grew up on a dairy farm. My parents had a dairy farm. Um, and I think I had to make that decision when I left high school. Was I got to stay on the dairy or go to college? And I thought, I could still go to college. I could still come back to the dairy farm if I wanted to. And then I had to decide if I wanted to go back to the dairy farm or wanted to go to veterinary school. I chose to go to veterinary school. And that was the most impactful decision I made, to be able to come home and help my parents on the dairy once I actually became a veterinarian, and some of the skills I learned there. And then I was in practice for a little bit. There was an opportunity to come to the University of Pennsylvania, the veterinary school. I enjoy working with the students, enjoy passing the knowledge on. I'm still my parents no longer have their dairy farm, and we have some new ownership. I'm still involved in it quite a bit, but it was the biggest opportunity, I thought, for me to make a difference. I had to decide: do I just want to stay on our own farm and do my own thing, or do I think that I have I don't want to say a gift, but I do have a passion for working with students who want to be a veterinarian. Just the tremendous impact that veterinarians can have on dairy farmers, and not just the cows. There's a lot of different things you can do related to veterinary medicine and cows. I think that's part of the goal today, to share some of those different careers. So it's just the biggest way for me to make an impact. So yeah, it's been a really good fit. I'm in my 10th year here at Penn Vet, so plan on being here a little while. So it's a good question. Thank you.
Oh, we love that. Well, thank you so much for just having that passion. And maybe there's some people here live that are thinking about being a vet as well. So, maybe UPenn's where you want to end up being, and you get to hang out with Joe, and it'd be a pretty cool opportunity. So thank you so much for what you do. And just giving us a quick little show, and also getting to see these cute calves, because they were a lot of fun to hang out with.
Absolutely. So great. Yeah. And, if you're interested in veterinary medicine, Penn Vet, it's the state's only veterinary school. So it's a great place to pull all these people together. So anybody interested, we're looking forward to seeing you here. So come down, see us.
Awesome. Thank you so much, Joe. We're actually going to switch over now to a different camera here. We're going to move on to a new part of the farm. So now we're going to move to the hospital barn at Marshak Dairy. And with us today, we have a very special guest with us, and I'm working on switching our camera over to them. Here we go. So with us, we have our Pennsylvania State Dairy Princess, Selena Horse. So good morning, Selena. How are you doing today?
I am good. Good morning, Brittany. As she said, I am Selena Hurst. I am your 2022 Pennsylvania Dairy Princess. So with us today, we are going to be joining you virtually. We are at the William Boucher Field Service at New Bolton Center, provides routine and emergency health care for equine and food animal clients. Field service specialists offer preventative health care representations, services, evaluation and treatment of lameness, medical and surgical disorders, on-farm diagnostic services, and emergency services. Emily, a UPenn food animal service specialist, is going to talk to you today how she helps the dairy cows here at the hospital barn at Marshak Dairy and about careers in the veterinary industry.
Awesome. Thank you so much, Selena. We are excited to meet Emily, one of those UPenn food animal science specialists. She has a lot of great things to share with us today. So we are excited to kick off our careers portion of this tour and get to hang out with Emily. And just like with Joe, Emily's going to be hanging out with some people live as well. We're going to get a little intro here from Emily before those students join us live. So hello, Emily. How are you? Thank you for joining us.
I'm doing well.
Today.
Yes, absolutely. Thank you so much for having us. We're really excited to have you all here virtually, in person, everything, so that way you guys can kind of see all the different aspects of dairying, and then also specifically for me, learn about being a veterinarian and specifically a dairy vet. So basically the kind of goals here, we're going to go through a little bit about what I do every day in terms of being a food animal veterinarian. My specific interest is dairy cattle. So very pertaining to this topic here. And then we'll also take you guys in so that you can see what we do during a physical exam on a cow whenever we get called for any sort of sick animal appointments or anything like that. I think our in-person people just arrived. So I can kind of carry on because I think Dr. Drake is going to run things with the in-person people, if you guys are okay with me just continuing. So for schooling, since this came up with the last group and my path to kind of becoming a veterinarian, I grew up in Harford County, Maryland, worked on some dairy farms there. My best friend had a dairy farm growing up, so pseudo I had a dairy farm and got kind of in touch with different dairies in the area, worked for them as a milker, farmhand, anything like that, as well as starting to shadow large animal veterinarians. Always knew that I wanted to go into food animal veterinary medicine, so I went to the University of Vermont. They have an excellent animal science program, dairy program specifically. Some of the students were asking any suggestions if you're interested in going into food animal veterinary medicine at all. I always say if you're interested in agriculture at all, go to a college that has a great agricultural program or anything in relation to animal science. Those schools typically are very specialized to try to set people up for future careers in that area. And that's a great option for anyone that is looking for that sort of a career in the future. And then for vet school, I came to the University of Pennsylvania. So I graduated from here, did all of my schooling here. I went to Ohio State University for my first year of practice, my internship year following graduation, came back to Penn for my residency here in field service, and now I'm a staff veterinarian here at Penn Vet. So that's kind of the trajectory. If you are interested in going into vet medicine at all, you'll need to go to college and then also to vet school and carry on from there. So in terms of a veterinarian's role on a dairy farm, obviously it's kind of very multifaceted. So first and foremost, my patient in general is the dairy as a whole. So that's kind of one of the special things about being a production animal vet. It's not just about individual animal care. There's a lot of aspects of my job where I'm looking at the entire herd as my patient. And so I'm putting together health protocols. I'm doing walkthroughs with owners, looking at facilities or any other kind of disease concerns or anything like that. The biggest thing in being a vet for production animals is I want to put together enough protocols that this dairy can function without me having to be here every day. So I need to train the employees. How do we identify sick animals? Usually on my farms, I've got a few people that I've worked with to train them on how to do a physical, so that way they can kind of start diagnosing problems and figuring out what diseases we're dealing with and start those treatments before I have to necessarily get involved. Obviously, I have many different farms I have to go to every day. So I can't just be in one place all the time. And so that kind of training aspect is a huge part about being a large animal veterinarian. And then on the other hand, we do individual animal care. So we'll be here almost every week on this dairy in particular, doing any sort of reproductive examinations on the animals, trying to figure out which cows are pregnant, which cows are not, helping them with any sort of fertility problems. But then we'll also have to get called here to look at sick animals in particular. So whether somebody has noticed that a cow is not eating as much, or usually our primary metric that will say, hey, this animal's a little off, not doing so well, is we can track their milk production in the parlor. So I always say, happy, healthy cows make milk. Not happy, not healthy cows don't make milk. And so one of the biggest things is the computer tracks every single cow's milk production every day. And then the system can predict what they should produce the next day and the next day and the next day. And when she comes into the parlor, if she doesn't meet that predicted value, the computer is going to flag that to the farmer, say, hey, this cow might be having a little bit of an issue. And either the farmer themselves might take a peek at her, go ahead and do that physical exam I've trained them on, or that's when they might call us as the veterinary team out to try to examine them. So whether that's just doing a physical, figuring out some medical problem, and we just start some treatments and everything, or maybe it ends up being a surgical problem, and then I have to actually do surgery on that animal. One of the coolest things about my job that all of our students and anybody that ever shadows gets all excited about is we don't send the animals always into the hospital for surgery. It's very common that I do the surgery right here on the farm. So that's kind of special and a little bit different than any other type of animal in veterinary medicine. So if anybody doesn't have any questions yet, we can probably head into the pen here and start working with our cow a little bit. So I can show you guys kind of what we do for physical exams and such.
Yeah,
does that sound good?
Great. Yeah,
awesome,
no
great.
Yet, but we're excited to.
Perfect. Excellent. So we'll pop in here and we have all of our patients here. You guys will kind of see everybody else in the background divided up with all of our doctors and everything. So we'll work with this cow right here. So the biggest thing that I always tell people, usually you have to either get the animal into a restraint system like this, or she'll already be caught up. So we do an overall look at this animal and we say, does she seem bright? Does she seem dull and quiet? So she's got her ears up. She's kind of tracking everyone around her right now. Her eyes are nice and open. She's looking at Dr. Drake there saying, why are all these people around here? So we'd say she seems quite bright. She seems quite happy and alert and kind of attentive to her surroundings. So that's a good thing. Obviously, if she was quite dumpy, not really responding when we were moving around, that points to an animal that's a little sicker than what we would like them to be. So then the next steps would be that we'll come into the pen here. And I always tell everybody you have to be cautious. These are nice and large animals, but on the nice side, these are dairy cattle. And so they tend to be a little bit more handled, and she was perfect in our last group. So hopefully she'll continue to behave for us. So usually when we do physical exams on cows, we actually start at the back end here. I'm not sure if she'll respond to us in this step since she did it the last group and everything, but we can actually ask them to produce a urine sample as the first step of our physical exam. So we just rub on this section that's right between her vulva and her udder, and usually, there we go, we've got a urine production right there. So I can take that urine as a sample. I can go ahead and test it for different qualities relating to her kidneys. I can also kind of run some on-farm strips that will pop up depending on certain diseases like ketosis or anything like that. So just having that kind of quick little trick that we can do to get a urine sample from there. We would want to check their vulva. If you want to come this way, you can always get a picture of it to see that she's got very pink, moist mucous membranes. That's excellent. That's a great sign of good hydration. She's not anemic. It's not super pale. And we wonder, are we losing blood or anything like that? And then I would move on to taking a rectal temperature on her. So typically, just like dogs and cats, when you go to the vet for them, we do rectal temperatures on these guys. It's going to be your most accurate type of temperature. So that'll be a really good evidence for us whether or not this animal has any sort of a fever, or even if they have too low of a temperature. So either of those could be from an infection. So that's always very important that we want to assess that on her. And then we're going to move around. I'm just going to ask you guys to step up just a little bit so I can open this gate. Thank you so much. We'd move over to this side of the cow on the left here. And so basically our steps on these animals is going to be exactly the same as on a human or anybody else that ever goes to the doctor, right? What do they listen to? Heart, lungs, they start asking about your GI and everything. And so it's the same thing with these guys. So we would slide right in here with our stethoscopes to try to listen to her heart. We'd be listening to make sure that we don't have any sort of a murmur, and our beats are very regularly spaced. Everything sounds very normal there. There are many diseases that cattle can get in relation to their hearts. And so it's very important that we listen to that, but also just the rate that their heart rate is. So is it really high? And that could be indicating either pain or some sort of an electrolyte imbalance. and things like that. And so we always listen to the heart on both sides of the animal. We'll then follow up and listen to her lungs. I always say to people, it's a little surprising and confusing because I know her rib cage goes all the way back to here. These guys were not made to run marathons. They're not like horses. Their lungs actually don't extend that far back because they basically just eat all the time. Most of their body weight is GI. So all of their GI contents actually push up into their thoracic cavity up here. So actually her lung field is really only able to be listened to in this very small little area right here. And so I'd listen in a few different spots so that way I can once again assess her rate. So how many breaths is she taking per minute, but also I can listen to her different lung fields, so the different portions of her lungs to hear, do we have any crackles or wheezes, which would represent some sort of pneumonia or respiratory disease like that, or does it sound very clear and air is moving very easily? So it's really important to not only just listen for the rate, but also to check each of those different spots because certain diseases will affect certain lung lobes in different locations. So by kind of differentiating that, I can tell what I can actually try to decide about what disease she's suffering from. And then, like I said, she's all GI. That's all she is. Ruminants are just massive fermentation vats. So people have probably heard that cows have 4 stomachs. Cows don't have 4 stomachs, but they have 4 compartments to their stomach. And so one of those is the rumen over on this side. And it's basically just this giant sack of feed that just has a ton of bacteria and other microbes turning it over, trying to digest all those little pieces of food. And so it's really important that we listen to that and we make sure that that is working properly. If the rumen starts not working very well, we start to have a big problem with these animals. So usually what we would do is we place our stethoscope right here, and listen for a full minute, and we count how many contractions that rumen is having per minute, just to make sure she's digesting properly. We then listen to the side of her, trying to find what we would call a ping. And so it's a very high-pitched metallic tone. And so basically I would put my stethoscope on her, and then I would just flick all around it. And so if I'm moving this around and all I hear in my stethoscope, if it was in my ears, is a thudding noise. That's very normal. That's just my fingers. And you can see she's flicking a little bit. She's like, hey, get that fly off of me, but it doesn't hurt her or anything. But if I hear that ping, that's an indication that unfortunately she's twisted her stomach. She's got a lot of gas and fluid building up in there, and now I have to go and do surgery. So that's kind of that complete exam that we would do on this side. Then we would move over to the right side and we can go over there. We would do all of the same things. We just wouldn't listen to the rumen on this side because her rumen's not located on this side. Over here, we have other large intestines, small intestines, things like that. So I would still do my heart, my lungs. I could listen here just to hear all those other GIs, but it's not the same as listening to the rumen. And then again, I do my flicking over on this side. On this side, lots of things can ping. Different GI structures could ping very normally over here. And so it's not always surgery if I hear something crazy over here, but it still could be depending on the location on our abdomen that I hear that. After that, obviously, she's a dairy cow. So we have to take a peek at her udder. The biggest thing is obviously they can get mastitis, which is an infection of the udder. And so that can cause very abnormal milk. It can get very clotted, kind of looking like cottage cheese. The milk could change colors, anything like that. And so to start with, I would first just go ahead and I would feel all of her quarters. So remember, there's 4 quarters on this cow. And I'd want to make sure that they all feel very kind of soft and pliable. There's no major heat or anything like that. It's not red, indicating any sort of inflammation. So all that feels very good. Then I would go in and I would actually get a milk sample from each of her quarters and check to make sure that it does look just like the milk that you're getting from your grocery store. And then I would get a sample from each of those quarters. I can put a special chemical into it, swirl it around, and if the milk kind of turns into this jelly structure, it can indicate that there is potential mastitis there as well. So 3 different tests that we do to their udder, just to make sure that their udder is in really good health. Obviously, that's important for her health in general, but also it's important for her production level as an animal on this farm, right? Her whole job is making that milk. She's basically running a marathon every day by doing that, and we appreciate that effort by her. And so we want to make sure that her udder is super healthy. And then the final step in doing our physical exam is we need to do a rectal palpation. So you guys have probably seen before these large animal vets on TV. They get this big long sleeve, they bring it up on their arm, and then we lube up and go in rectally. And we can feel a bunch of different structures inside of them. So I would first assess her uterus. That can tell me if she's pregnant, if she's not pregnant. I can assess what stage of pregnancy she's at. I can also find any sort of a uterine infection. So the cow over to the side over here, she had just calved this morning. And so in the next next few days, we want to make sure that she does not develop any sort of a uterine infection. And so if I got called here, tomorrow or the next day, part of my exam would be assessing to make sure that her uterus has gone back down to the normal size that it's supposed to be. It doesn't feel like there's any sort of gross discharge or anything. So it's very important that we pay attention to that. When I'm doing the rectal, I can always also reach forward and I can actually feel that rumen that we talked about. So that big sack of feed in there, and I can feel, does it feel like it's a little less full than it should be, or does it feel normal and everything feels very nice? I can even reach one of her kidneys in here, so I can give it just a nice little tap, make sure that she doesn't have any sort of a kidney infection or anything. And so there's just so many things that we can assess by doing that step. It's a very important medical procedure that we do on these animals to be able to assess that there's no kind of disease or anything wrong in any of those different organs in the animal's body. And so basically just doing all of that big complete physical cues us into, are we dealing with a GI disease? Does this animal have pneumonia? Does this animal have that udder infection? So that way then I can start different treatment protocols to try to get her back on track, get her healthy again, but also get her producing appropriately again. So that's where kind of the veterinarian comes in on an individual animal basis. And then obviously we might see trends. So I might start noticing that, hey, the last 5 sick cows I've seen here have had this same disease process. So that can help me kind of take that individual animal and extrapolate it out to the farm in general and try to figure out, do we have an outbreak of a disease process happening on this farm that then I have to try to kind of solve the problem there.
Right.
So that's kind of it for, yeah. It's interesting kind of that change that goes back and forth in being a large animal vet. And it's what I like the most about being a production vet, from the individual animal care back to the group care, back to the individual animal care. We see that in adult cattle as well as in calf care and everything like that. And so it's all a very big system. And obviously you guys are hearing from all the different people that are involved in that system today. And so usually we all have to work as a team, consult with one another whenever we start seeing problems. For example, if I started noticing that more and more cows were having that problem that I discussed over here, where they might twist their stomach and I have to do surgery, I'd go talk to my nutritionist, say, hey, it seems like I'm having a little bit more of this problem. That problem in particular can be directly related to a nutritional problem we'd want to work out. Is the nutrition proper here? Did we have something happen with how we're mixing the feed and it's not being mixed properly, or any problems like that? So it's really a group effort on the dairy between the veterinarian, the farmer, all of the other kind of different consultants on the farm to make sure that everything works appropriately and all the cows are happy and healthy.
Yeah, that's incredible. I mean, we all know our dairy farmers, of course, are superheroes, but as you just said, it is a team effort. They need and rely on you guys to make sure everyone's happy and healthy. And obviously your work is incredibly important. We did have a question. They were asking, how often do the cows get these kind of healthcare checks? Like, is this like once a week, once a year, what is it? Or is it just when they're not looking well, or what's that look like?
So specifically from a veterinarian, it would be when they're not looking well. So that's usually the big time that a vet is going to get involved. Now, in general, this whole farm gets assessed every day by all of the people working here. So like I said, I set up protocols to try to train people on how to assess these animals. So as the pens are being cleaned, the guys are walking through, they're looking as the cows are moving. Is any cow lame? So are they limping and not feeling so well? They come out to get the cows up to go milk. Gosh, this cow didn't get up. Why is she not getting up? So while I might not be doing an exam every day on these animals, all of these animals get an overall evaluation by everyone that works on this farm as they're being handled and moved and kind of worked with throughout the day. Particularly, that's very important with the calf care. So I always say that the entire group of calves gets assessed on a medical level multiple times a day whenever they get fed. So whoever's coming out with the milk, I always tell them, you got to take that moment to stop and look at the calf. Does the calf seem bright, excited? Are they jumping up, coming to the milk or not? By doing that group exam, you can then create your list of individual animals that seemed off. And then the farmer would go ahead, they'd do their own little exam, figure out if it's something easy for them to assess and then treat, or do they need to get me involved? So from a veterinary perspective, I only see them when they're sick and they need me, other than just my weekly exam of the reproductive tracts and pregnancy diagnosis and such. But every animal on this farm is being assessed for their health and well-being every day by the farmer and all of the staff that's working here, as well as the advances in technology that we can use to kind of try to assess that from a data-driven set. So we already talked about like the milk production being monitored by the milking parlor and everything. There's plenty of other monitoring systems, whether it be rumination collars that will measure how often that portion of their stomach is churning over simply by how are they chewing, how is their head moving, things like that. So you can actually get a readout on the computer from every every single cow on how they're doing and how they're digesting every day. And that can help farmers pick out, hey, that cow's not doing as well, without them even having to go look at the animal. You can have activity monitors on them, whether it be ear tags, collars, or anklets that gets put on them, that they can identify animals that they're not really being as active as they usually are. I should probably go take a peek at her and see if she's not feeling very well, or the opposite, and they're being overactive, which usually indicates they're what we would say in heat and ready to be bred. They typically have a big uptick in their activity because they're running around all crazy with their hormones flowing through. And so there's a lot of different methods that we can use to evaluate them. But just from a vet perspective, I'm only really looking at them when they're actually sick.
Sure. No, absolutely. I think that sounds awesome that they have their own like Fitbits. Like, well, how cool is that? That these guys, that, you know, they can help. That can really help you and the farmers track their health. We did have another question. So obviously, we did this healthcare exam on a grown cow, and then you mentioned how you have to kind of observe calves. Can you just maybe talk a little bit more about what does that observation look like for calf? Like, do you have to still do the pinging of the stomach with the calf, or like, are you just taking temperatures, or what does that look like?
So it's a little bit different when we do it on calves. Absolutely. They just aren't as developed and fully grown as these guys. And in fact, actually, their entire GI system is totally different. They still have those 4 compartments, but only one compartment's really working when they're little tiny calves. And so it is a little different. Whoever asked the question is actually right to bring up the pinging aspect. So I wouldn't ping them. So when I'm doing a physical exam on a calf, I'm taking their temperature, I'm listening to their heart and lungs, but then I'm doing more kind of physical with my hands evaluations. I'm going to go ahead and actually palpate their umbilical cord, the little remnant that's still there, make sure it doesn't feel thickened and infected. I always touch their joints a lot. I squeeze on them, make sure that it doesn't seem like they're stiff or there's any sort of kind of swelling or anything that can indicate some sort of an infection. And so it's just a little bit different. We don't do this massive big thing for them, but they get their own kind of specialized little exam. And so, yeah, you're just listening to that heart, listening to those lungs, feeling the umbilicus, checking on those joints, all of that. So they're not as in depth, and it is a little bit different than cows, but it's still a pretty involved examination whenever somebody does an exam on a calf.
Awesome. So another question. Now, you mentioned if they're not feeling well, then you have to treat them. What is something that you do when you have to treat a cow, and do you have to treat them for a long time? Is it like a one-day process? What does the treatment process look like?
So it totally depends on whatever disease we are treating, what type of medicine that they need, right? Like if you have a cold or, pneumonia or anything, you need totally different meds than if you have diarrhea. And so it all depends on what type of treatments we have to use, what certain drugs we have to use. Even the antibiotics themselves could need to be given either for just 3 days or 4 days or 5 days or just one time. So it's completely different depending on what disease we're treating and what actual products we're using. Most commonly, obviously there's infection. We're going to be using antibiotics to try to fix that. We do take a lot of consideration into any sort of pain or discomfort in these animals. So we'll incorporate either non-steroidal medicine, so kind of like Advil, but for cows, or we'll use steroids if we need to, if the inflammation is that bad that we need something a little bit stronger than that non-steroidal. And then there's also some topical things that we can do for them. Obviously if she has a foot disease or something, I might need to wrap up her foot, put some kind of topical medication on there. It really just all depends on what disease we're treating in terms of what medicines we're going to get into to start using for them. My favorite thing is obviously if they have any sort of an upset stomach or anything, I always say to my vet students, what do you do whenever your stomach's upset, right? You take Pepto-Bismol, you take Imodium, something to kind of make you feel a little better. We do the same thing with them. So they actually get what I call a smoothie, where they get a lot of good probiotics and actually the cow version of Pepto-Bismol and some electrolytes just to kind of keep them hydrated and everything. And so we have to give them their nice little cow upset stomach smoothie whenever they start to have any diarrhea or anything like that.
Very cool. I love that.
Yeah.
Now, obviously, you are sharing a wealth of knowledge for us, and we are absolutely loving this. But I would love, and you talked a little bit about your background and your education. So obviously, you've been in school for a while. You've learned a lot of these incredible things. But if you don't mind kind of trying to share with us, what are some key skills that you need to be in a career of veterinary science?
What did you say? Okay. You're coming across just a little bit muffled. Could you repeat that last part just a little bit?
Yes. Can you hear me any better now or no?
Yeah, that's a little better.
Okay. We obviously have a lot of education. We were just wondering, what is a key skill that you need to be in a career in veterinary science?
Yeah, so obviously it takes a lot of passion and dedication. That's the biggest thing. I always tell people you don't become a veterinarian just because you love animals. Obviously, everybody loves animals. We all want animals to be so cute and happy and healthy and everything, but you have to be really dedicated to it. You have to love science. You have to always have this curiosity of wanting to learn more. Obviously, I'm done my schooling, but medicine always changes. So even through my whole vet career, I'm going to be going to conferences and things like that. I always say the school's never really over. We're always still in school. But my biggest thing, like I said, an interest for science. You do have to know how to do some math, unfortunately, but definitely just kind of that overall curiosity and dedication to it. Schooling can get really hard and really complicated, and you kind of hit a point where you're like, man, do I really want to keep doing this? But if you find that drive and you find that passion to keep wanting to learn and keep going through it, that'll always help you kind of make those goals and everything. So it's not just loving animals, it's having that background in it. Obviously, if you're interested in going into this, try to find a way to work on a farm, try to find a way to shadow vets and everything, so you can really get the feel of what it is to actually work this job and work in this industry. Obviously, it all looks, probably very nice and wonderful through the camera and everything, but when you're working it and you're out here and it's kind of chilly out here today, it gives you the real example of what it's like on a kind of full-time basis to get to have that in your life. And so just go get those opportunities and make sure that you really do love it and just find that passion for it. And that'll keep you going even in those hard times.
Awesome. Thank you so much, Emily. This has been wonderful. And just checking, can you hear me any better now?
Yes. Yeah.
Yes. Okay, perfect. No, this has been wonderful. I'm checking. I don't know that we have any more questions at this point, but is there anything before we kind of move on to the next spot? We've got a minute or two. Is there anything else you wanted to share with us just about your career, or what's your future goal, or what's your next steps, or anything like that you want to share before we move on?
Yeah. So, my path after vet school was a little different than most other veterinarians. I specifically wanted to work in what we would call academia. So working at a veterinary school following graduation. I love teaching and I love being involved with all of my students and everything. So I kind of wanted a career where I could be a vet, but also be involved with teaching and such. And not just teaching my students, but something like this, where we're getting out there to the public. We're working on kind of expanding knowledge about the industry and all different areas of that. And so while most people, once they graduate vet school, we're fully doctors when we graduate, they just move on to practicing. I actually went on to do those extra years, going to Ohio State, coming back to Penn for a little bit to become kind of that specialist status. That way I could go into it. So my goal is to stay kind of in academia and continue through that teaching for kind of the rest of my career and everything.
Awesome. We love that. And, while not everyone has a different path, we love that you're willing to be here for the education portion. And I'm learning so much just sitting here listening to you. So I'm sure you are exactly where you need to be for your career.
Thank you.
This has been incredible. Thank you so much for sharing all of this with us. This is really
absolutely great. Thank you guys for listening.
Absolutely. All right, everybody. We are going to go ahead and get shifted to our next speaker. So in the meantime, we're going to hear from Selena again, who's going to introduce our next speaker. So we're going to go ahead and get our next camera up, and let's see if we can get Selena on board here soon. And I believe, just as a little hint, we're going to get to talk to our nutritionist next, I believe, and get to hear a little bit more from them. So we're going to go ahead, just giving them a second here to switch over. All right, and thank you so much, everyone, for those awesome questions. We've really been enjoying this, and feel free to go ahead and use that chat to ask any questions you have. Miss Emily was incredible to chat with. She had a lot of great knowledge and clearly a very awesome vet. So if you ever have any questions, you can always reach out to us too after the farm tour, or put them in the comment section of this video later on. And I'm sure we can have someone help answer your questions if you're interested in a career in vet science or anything like that. All right, so it looks like we're getting our next camera up and ready.
Okay, hi everybody. My name is Dr. Linda Baker, and I'm going to be running this next nutrition section. So I wanted you to see what we call a total mixed ration. So it's all the feed ingredients mixed together, and we'll see the individual feeds. But I wanted you to take a look at this, what the end product is. So if you look here at this This total mixed ration will have all the feed ingredients. So you can see some hay. You can see some corn silage in there. There's some shelled corn, ground shelled corn, and also some protein mix. So this makes up a nice TMR. And so the purpose of a total mixed ration is so that a cow takes one bite and it's all the same. So she's not having individual feed ingredients. However, a total mixed ration is very popular on larger farms, but when you go to many Mennonite and Amish farms, they do not have a total mixed ration. So they are what we call component fed. So they will feed all the cows hay, then they'll feed them corn silage, and then they'll come along and with a cart and feed them their protein and corn on an individual cow basis. So we have 4 TMRs in this barn because we have 4 groups of cows. It's the same 5 ingredients, but they're put in different proportions. So when you're on when you're feeding an individual cow, it's like you have 30 to 50 TMRs. They're not mixed together, but they're fed individually to that cow. Here we feed every. And we can turn to your left. Okay.
Awesome. For everyone watching, we are with Dr. Linda Baker. She's the Assistant Professor of Dairy Production Medicine at University of Pennsylvania Veterinary Medicine. So we are very excited to be hanging out with her as she just talks about the importance of nutrition and the crops for these farmers. And we were just talking with the vet, Emily, who talked about a little bit how important it is for these cows to have the right nutrition. Otherwise, it could cause some upset stomachs and some issues. So thank you so much, Dr. Linda Baker, for going over some of this with us and sharing your expertise on nutrition and crops.
Oh, you're welcome. Thank you. Okay. With all good nutrition programs, we have manure production. So probably about 30% of the protein, about 50% of the ration is digested and the rest is in the manure. So with a manure system, we have a flush barn. And so we have water in these towers and there's jets at each end of the barn that will open, flush the manure to the center of the barn. From that, it goes underground and comes out here into this reception pit. Then from this reception pit, it'll kick on this elevator, which is a manure separator, and it'll separate the solids from the liquid. And so the solids go on the one side or the one pile, the liquid goes into this first lagoon. And then there's a siphon out there. So when the water gets so high and the whatever debris is left in there sinks to the bottom, we have clean water going into that, not clean water, but we have just liquid going into the second lagoon. Then from there, we have a pump house, and that'll pump that water back up into these holding tanks so that we can flush the barn again. So it's sort of a little bit of a recycling. So that's how our manure system works. So that's part of nutrition. So we want to now go and look at some of our individual feeds. Watch yourselves.
So it looks like we're going into a commodity barn, maybe?
Yes, we are. We're going into the commodity barn.
Okay.
And we're going to see, so this is yet a third forage. So this would be, so we have corn silage and we'll see some triticale. This is chopped green hay. So as you can see, so we have a processor come and chop our hay that's in these bales. And so it fits into the TMR, it mixes in more uniformly. So it's a grass hay and it's chopped pretty finely. It's really important for dry cows who get 85% forage and a lot of hay. So it goes into the mix better. So then we have, this is cornmeal. So this is the shelled corn ground very, very finely. So this is almost like flour. So very fine. So we're trying to feed the rumen bugs of the cow. And so they like carbohydrates. So this is ground fine so that the microbes can digest it quickly. This is our protein mix and our blend. So each cow would get about 19 pounds of this. Within that 19 pounds, there's about 7 pounds of byproducts. So the byproducts consist of soybean hulls. So if you're going to make soybean oil or process beans in a different way, and you don't want the hull, you can, cows can eat that and do very well. The other thing that we have in here is bakery waste. So from the bakeries, you know, as they're making their breads and sweets, they have waste. So we get bakery waste. Sometimes we get candy with wrappers, but all cows can eat that. We also have wheat mids. Wheat middlings are what's left over from making bread, the flour industry. So we have these wheat middlings also get into this mix. So this mix contains a lot of byproducts that cows can eat that would normally go to landfill if they couldn't eat them. So they're pretty amazing that they can do that. So we also have soybean meal and canola meal as protein sources for the cow. So these feeds are expensive. The protein feeds are expensive. Right now, corn is expensive. So we want to make good quality forages so that we can reduce our feed costs by feeding less protein and corn. So those are the two most expensive ingredients. So now we'll take a walk back to this trench area. Yeah, it's a big mixer.
I was gonna say, Dr. Linda, is that the mixer next to you, that big red thing?
Yes, so this is how they mix the TMR. So all the ingredients go in that mixer wagon, and then it has, watch yourselves. Then it has a door that'll flap down and feed the cows.
Very cool.
Okay. I guess we'll go see this first. So we're gonna walk back here and see corn silage. And so right now we have corn silage in 3 trenches and we have some ag bags. And so every year we make at least 2 ag bags that won't be fed until next year. So right now we're gonna go see an ag bag that was made last year of corn silage. So we always want to have fermented feed on the farm. So we have these ag bags in preparation for when we fill our trenches so that we don't have to feed them right away, so that we can have fermented feed, which is a process where you take the oxygen out and it ferments and it'll keep a long time until you open it again and expose it to air. So we'll go down here and look at this corn silage. We have 5 full-time employees, and then we have several part-time employees, and we have student workers. that come when they can. So we milk twice a day, feed once a day. So our feed is, so we just keep pushing in feed to the cows each day, several times a day.
It looks like we've got some ag bags next to us, correct?
Yes, so we're going to see one of the ag bags, and this one has corn silage in it. So this is last year's corn silage. So corn silage is the whole plant that is chopped up. So it leaves about maybe an 8-inch stalk in the field. So the entire plant's chopped up. So because of that, we have fiber from the plant, and we have corn grain from the cob. So it's a product that's very easily for cows. They love it. It smells good. They eat a lot of corn silage. So on this farm, we feed about 60 pounds per cow per day of corn silage. It's our cheapest ingredient, so we like to maximize this. And the more starch it has in it, the less corn grain we have to feed, which is pricey. So we want to have a good product. So this is all carbohydrate, whether it's fiber or starch. So rumen bugs love starch. So it's a big fermentation vat. So we're feeding the bugs in the rumen. So if you want to smell any of this, you can pick it up, look at it. So we have a kernel processor on our harvesting equipment that will break the kernel into little itty bitty pieces. So you can't see any kind of kernel here. You can only see the starch on the leaves. And I think you can see how much starch is there and how much fiber. It smells great. You'd eat this if you were a cow.
I wish we could smell it. Oh, I love that smell of feed.
Yeah, it's a great smell. And so we have a lot of corn silage. So we'll walk down and I'll show you the trenches where we have more corn silage.
So you mentioned that corn silage was from last year. Is that
That's
normal? Or does feed stay in those ag bags for a year, or why is
Yes.
it freshly cut? How does that work?
Yes, well, we have freshly cut right here next to me. So this is a fresh this year. So we always make some ag bags. So this will be fed next year when we're making our corn silage, and it takes a couple months to ferment. So we try not to go on fresh feed. We want it all fermented. So we have to plan to make ag bags this year to feed next year.
Gotcha. That makes sense. Lots of planning.
Yeah. So we're going to walk up and look at our trench system where we have more corn silage. So corn silage is our primary forage. So we like to feed a lot of corn silage. So we have 3 systems here of 3 trenches full of corn silage. So how this is made is it comes in from the field, and we try to have like a 4 to 6 inch layer. Then a tracker will drive over that, pack it down. Then we'll get the next 4 to 6 inches. So we have a tractor with a great big front end loader that can push the feed, pack it down, get the air out. Then when that's all done, we cover it with plastic, and then we put these tires on it to keep it down so it can ferment and not get air under the plastic. So these tires are actually airplane tires, so they're very heavy. If you were to lift one, they're at least 50 pounds. They're heavy. So it's a lot of work to cover these, cover this. They're really heavy tires, and they should touch each other as much as possible. So we'll walk back here and look at another feed.
While we're walking, I will just say what a great way of recycling and using another resource on the farm. That's pretty cool to be able to recycle those tires and utilize them.
Yes,
to,
yes.
ferment the feed.
So we just keep them and use them every year.
Yeah, that's awesome.
So we're walking back to look at a grass forage called triticale. And triticale is a hybrid between wheat and rye. So we use quite a bit of this material to feed dairy cows. Okay, this is called triticale. It's a grass forage. And so you can see up in this field, they just harvested the corn. So you can see the stalks. We just make corn silage. So what we do then is we'll plant this grass seed in that field. And so it'll start to grow over in the fall here a little bit. It'll get up about, 2-3 inches. So then it'll overwinter. In the spring, we put some nitrogen on it, just like you would your yard, and it'll grow. And so it's usually about up to my mid-thigh when it's about harvest time. So you want to have it where the head is not sticking out. You want to have what we call in the boot stage. So you don't want to see the head. So with this triticale, it is a grass forage. We feed about 15 pounds of this per cow. So when it's in the field, it serves as a cover crop. So it covers these fields through the winter. And then we harvest it in the spring and then plant corn again. So it's both a cover crop system, so preserve the soil, and it's also double cropping. So we'll plant corn again after it's off. So we get corn and triticale, 2 crops off the same acre. So that's called double cropping. So that's very economical. So we have 2 major forages. So we feed 15 pounds of this and 60 pounds of corn silage. So it gives you some idea the proportions in those total mixed rations. So this is a good forage. It's almost all the plant fiber, no starch in this. So that's our triticale, and makes a good second forage. It gives us more fiber to balance the rumen. So if this is really good and digestible, gives a lot of energy to the cow, and it also has a fair amount of protein in it. So if this is really good and the corn silage is really good, it's just less supplemental feeds of protein and corn that are more expensive that we have to feed. So our ration is balanced for about 100 pounds of milk. Our cows make 80 pounds of milk per cow per day. And so each cow's averaging about 8 gallons of milk. So so we like to feed them economically. That when our milk price is based on milk fat and milk protein, and so how many pounds of that we're selling, and that's all nutrition based. So it's how you feed the cows, if they have enough fiber, if they have enough starch, what the balance of that TMR is. And so we have the 4 different TMRs. So then, we look at our fat and protein because it affects our milk price and our profitability. Are there any questions on anything we've seen? Did I miss anything, Dr. Rassler? Okay. I guess you're on to your next tour.
Linda, we have really enjoyed getting to follow with you today and getting to learn about nutrition. And I just want to say while they're switching rotations, I had a question for you. Obviously, we're talking about some pretty in detailed things, really talking about the protein and carbohydrate and fat content of these rations and of these feeds. How long did it take you to learn all of this? What was your education like to get to this point, to be able to learn all of this and make this amazing balanced diet for cows?
Okay, well, so I graduated from veterinary school. So I was in a dairy practice for about 2 years. And almost everything that I saw had some kind of nutritional basis to it. And so most of the diseases I were treating, I think could be prevented. So then I came back and did a residency in clinical nutrition. And so I went to dairy farms and I would help solve problems and reformulate their diets. And it was a learning process that took about a year to just, read and understand what I was seeing and how it was related. And so I completed my residency and I've been here ever since.
That's amazing.
Excuse me.
Bless you. That's amazing. I just can't even fathom. I mean, you pretty much literally have the health and well-being of these cows in your hands when you're thinking about these rations and making sure these cows are healthy. So we can tell how important your job is. Can I just ask, what's your favorite part about your job?
Probably how the nutrition affects milk production and how you can see it's helping farmers to make to be more profitable. So we're trying to save feed costs while still maintaining milk production, and so that helps their margin and helps them to be more profitable. And then that's the reward that they do well. Yes. Okay. He asked, how do we move it?
Yeah, because this stuff's. Oh, good question.
Yes. Yes, he does. He actually comes back here with the front end loader, and he will pick that up, and it is light. So part of the issue is because of the wind today too, and it's lighter, he may lose some. And so that happens on farms, and that's called shrink. And if you have a lot of shrink, that can be very expensive because you're losing your feed ingredients as you're loading them. And so that's a good question. But yes, because we are only feeding 15 pounds, it probably only takes 1 scoop for him to fill in the mixer wagon. So, but yes, you can see the feed on the ground that gets blown off. And so, yes, that's shrink, and that'll never be picked up. So yes, shrink is a big issue, particularly with forages.
I've only seen shrink house stored in silos.
All right, I am going to go ahead and move us over to our next rotation. Thank you so much, Doctor. It was great chatting with you. I appreciate it. We are going to go over and switch to Selena again here. So hey, Selena, it's great to see you again. I believe you are muted at the moment, but we are excited to hear who you're going to introduce to us next as we listen to our third doctor of the day. So, hey, Selena, go ahead and do our introduction. Oh, I think you're muted again. It was unmuted. 1 second. All right.
Can you hear me now?
Yes, go ahead.
Okay, great. Providing an easy and accessible working dairy farm for research trials is one of Marshak Dairy's main objectives. Research projects largely focused on nutrition, environmental sustainability, mastitis, and cow comfort. Today we have Dr. Doe, who is currently doing the research at Marshak Dairy, and then also Dr. Pitta is also here, but you'll be hearing from Dr. Doe today. Thank you.
Awesome. I love it. Okay, so thank you so much, Selena. We're excited to meet Dr. Doe and hear all about the research at Marshak Dairy. So we're going to go ahead and let them switch that mic over to Dr. Doe so we can get to chat with her. So we're very, very excited to learn about a little bit more about what they do at the farm. All right. Hi, Dr. Doe. Can you hear us? Oh, I think we're still waiting. All right, here we go. All right. Hi, Dr. Doe. Can you hear us?
Just a minute. I'm
All right.
adjusting the, yeah.
All right, we're adjusting.
Oh, my. A bad hair day. Just kidding.
Oh my goodness. Well, when it's that windy and everything else that's going on, and I heard it's really cold there today, so that makes sense that it's cold and windy, so makes for a bad hair day, I guess.
Yeah, can
All
you
right.
help? Can you hear me now?
We can hear you. Yes, absolutely. We're
Okay.
excited to hear from you. So I'll let you take it away.
Okay. Yeah, so I won't have students here. Okay, hi everyone. Yeah, so I'm a Dr. Doe. I'm a professor of agriculture systems here. I have been working here at Penn Vet for nearly 30 years, and my work here is primarily research. My research addresses environmental challenges associated with the agriculture, and my research projects, studies I have been doing, have done over the years are primarily about on the dairy. And let me just I think give you an example that would be easier to understand and to comprehend. So recently we conducted a feeding trial by using food waste. And this food waste specifically are generated at a fruit processing center near us. This is citrus waste that they separated from the good qualities, and this is a poor quality would not be suitable for human consumption, and therefore it would not go to the through the supermarket human food supply chain. So we decided to do a feeding trial and using our dairy cows to see if the cows would eat the citrus waste, and two, how they would function in terms of dry matter intake and production efficiency, feed efficiency, nitrogen efficiency, and also the milk yield and the environmental impact after that. So we had our whole herd was at the time was 160 milking cows, separated into separated feeding into two groups. One group receiving the control diet, which contained the standard feeding ingredients like corn silage and corn grain and protein mix and grass hay, etc. That's standard conventional feeding ingredients. And then the other group for treatment receiving citrus waste. So we used 16 pounds per cow per day of the fresh citrus waste in the diet. Of course, the 16 pounds of citrus waste would displace some of the conventional feeding ingredients, right? So we did this, made the different diets on a daily basis. Every day we monitored the feed intake, and we recorded the milk yield. And we did this study for 24 days. And of course, we monitored the cow performance and how they liked it and well. So long story short, and to the end, when we added all this data together and analyzed it, what we find that is that the cows fed the citrus wheat diet milked better, and on average it was 4 to 5 pounds more milk per cow per day. So what this means for the farm would be when it's more milk, of course, and bigger milk check, right? And also with the citrus fruit replacing some of the conventional feed ingredients, your feed cost is lower. So that's the double benefits on the farm economically. And then we also based on the feed usage and dry matter intake, etc., the feed conversion ratio was better and more efficient in the feed usage, and also higher percentage in nitrogen capturing efficiency. And in terms of the nitrogen captured in the milk protein versus the what was fed in the diet. So feed used more efficiently, nitrogen used more efficiently. Now, beyond the farm level, we also estimated, calculated the cascading effect, because now you conventional feed ingredients, you have the reduction. That means you no longer need to the land to produce this feed. So at the herd level, we calculated if we are to feed 16 pounds of citrus waste per cow per day for the whole herd, on a yearly basis, we would spare 12 acres of land, right? And then you would spare nitrogen fertilizer, phosphorus fertilizer, and the fuel related to this field operation of crop production. So the nitrogen fertilizer we calculated is more than 700 pounds per year. And then phosphorus was more than 200 pounds per year. Of course, reduced fertilizer usage, that means reduce the cost to the farm and reduce the potential environmental impact, nitrogen losses to the water. And you help to preserve the non-renewable resources like phosphorus.
Very cool. Very cool.
Yes.
Wow, that sounds like some incredible research that you get to be part of. That's just incredible. Oh, what do we have over here? This looks pretty cool with these little huts over here.
Yeah, this is you can see the feed as well there. So this is we call it a kaolin tub. This is something we recently purchased and installed. This will help us monitor the cow performance and how much they eat and the behavior, and to give us a better facility, better way to do the research, the feeding trial. When I did my feeding trial, it was the whole herd, but this would give us the opportunity to measure the better control. Yeah.
Sure.
Better management. Yeah.
That's incredible. Huh. So in each spot right there, is that just a different cow, or the different feed in each one?
It's for different cow. So each cow each cow has her own tub. Yeah.
Okay.
Yeah, this is the early stage of the training, training the cows to get used to using this facility, and also Jane, that machine at the end is called the green feed. Maybe are you going to have Dr. Pita later for this virtual? No. Okay, let's walk down there. So the end piece.
Look at them. They have their own little holes to eat. That's pretty cool.
Yeah, we have 24 kaolin tubs here. We can have 24 cows in this study, and this make it a lot easier for us to measure how much each cow, how much we fed and how much she was left over. So this machine at the end is called green feed. This is the newest piece of equipment we acquired here. Dr. Pita has been using it and training the cows. So what this does is for us, to measure measure on site the methane emission from the cow.
Wow.
Methane emission from the cow. So what you do is that at the other end of the machine, the cow put their head into it, and for 5 minutes we have some treats there, the feed treat there. So for 5 minutes, she will be eating and breathing, and the breath will be sampled and resampled, and then collected, sampled, and analyzed for the content of methane and CO2. And then the data was sent to automated system. Then we can measure on site and live about the methane emission.
What?
And also because cows will be receiving different diets, and like a different diet may have a feed manipulation and different formulation, and we can see the different feed formulation and the impact on the methane emission. And a certain seaweed, certain products would help reduce the methane emission. And the cows eat there at the killing tub and come here to the grain feed. We get the sample. We can get over the time do the statistical analysis and have the actual evidence, the
That's
data.
incredible. What an awesome sustainable story. It's obvious and it's not a secret that it's always a topic of conversation, whether people know dairy or don't know dairy. So it's just really cool to kind of get a firsthand look at how we research that methane emission and how do we, and what you're doing to help, lower that by changing their feed and just the rumination and everything. So that is really cool. I've never seen that before. So I think that's really neat. And I hope everyone else watching online is enjoying that too. That's such an awesome opportunity to be able to track that and really get awesome, like the results you need to see and the reports you need to see to know if it's working. So that's pretty cool.
Yeah, absolutely. Yeah, later on, our future planning a future feeding trial, and that with that one we'll use this green feed, and so measure not only just the cow performance in terms of productivity and feed use efficiency, nitrogen use efficiency, but also how they do in terms of methane emission mitigation using this machine. We are quite excited by acquiring this facility. We ordered and waited for something like 6 or 7 months to get this machine. Yes, yes.
So now how long will this trial run now? Will be like a year or 2 weeks? Like what's the timeline like?
Typically for a feeding trial, we use at least 3 weeks because you are testing a different type of diets. The cows need to get used to it, and then you collect the samples continuously for several days to give you the reliable, accurate measurement. So at least 3 weeks for one feeding trial. And we actually here is really busy with this research dairy herd. Several faculty members have research, have studies. So we coordinate and we align our studies and by using this facility and of course using the cows. Dr. Pita currently is she's in the, as I said, this is the early stage. We're in the stage of training the cows for using the facility. And she has 2 research trials planned out. I have at least one using the kaolin gates and using the grain feed. Yeah, so this will keep us busy and the facility busy for probably 2023 into 2024.
Wow.
Yeah.
Oh my goodness.
Yeah.
That's incredible. What I gotta ask, this is just, a lot of knowledge, and for someone that I personally would get lost in the science, but it's very obvious you love it and it's so important. And I just want to know, whatever got you inspired to get into research? What's the reason you started doing research and dairy specifically?
Yeah, on dairy actually it's yeah, long story. I was actually trained. I have a PhD in soil science. So when I came to work at Penn Vet, and the time people were researchers, scientists here were really ahead of thinking, and that was nearly 30 years ago. They realized that the Chesapeake Bay water protection and stuff. It's important to manage the manure in the field, but really we need to manage the feeding program and manage the cows. So they realized that we can buy precision feeding. At that time, that phrase was not even in circulation yet, right? But the thinking was about precision feeding and to start with ration formulation and optimizing the nutrients in the diet to meet to support milk production, to support good cow health and productivity, at the same time minimizing the nutrient excretion in the manure and helping with the manure management and with the water protection. So that time I came as a soil scientist, we did, so I focused on the manure part, and my colleagues here with the dairy nutrition and dairy health and management background with that expertise, they managed the front end, and together we managed from front end to the rear end. So really it was nowadays I think the interdisciplinary research and teamwork really opens up a lot of opportunities. I find it's very rewarding working here and with the dairy nutritionists and who are expertise about dairying. Yeah.
That's awesome. I love it. And we can feel your passion and excitement for research, and clearly it's just it's really exciting and can really revolutionize what's to come for the dairy industry. So thank you so much. Now, I did have a question. If someone decided that they think maybe research sounds like something they want to do, what are some skills or some attributes that you think are important for someone to have to be a researcher?
I think the basic knowledge you learn from college and beyond during graduate school is all important and could be all applicable. As I said, I was trained as a soil scientist, and I came here. I find a way of using my knowledge learned from soil science to the dairy and help with the dairy management and for win-win situation, meaning for the dairy industry and the community, but also the win for the environment. I think so. The basic training is important. Basic knowledge is very important, and also really keep an open mind. And nowadays with this interdisciplinary and the collaboration, you never know what kind of opportunity would come up, and you never know what career the path may lead you. But you need to be well trained and prepared. And again, even the basic chemistry knowledge and would be helpful eventually with the application on the farm.
Sure. So if anyone, when we're watching this, if you have an interest in chemistry and just like really, helping move the industry forward and a drive to work with a team, it sounds like you've got to have some pretty good team skills to work together so that research projects can come together. It sounds like research would be something that would be good for you. So that's awesome. I do have another question that came in. We were wondering, what is your favorite research project that you've ever worked on? Something that maybe was really revolutionizing or just really fun to do. What was your favorite research project you've had a chance to work on?
The feeding trial, citrus feeding trial is my current favorite.
Yeah.
Yeah, because you really see the milk yield increase by the cow. So it's on a daily basis. That was really interesting and exciting and inspiring. I mean, I was inspired by the cows, how they responded, right? Yeah, so that's my current favorite. Actually, in the past, I had a long study, many years, and a large scale and a multi-state that was focused on phosphorus. That was my favorite because at the time, for a long time, there was the misperception about phosphorus, and we thought phosphorus in the manure would not and in the soil would not go anywhere because it's not soluble and it's relatively benign, etc. But I did quite some study there and applied my knowledge about phosphorus fractionation and phosphorus solubility and the laboratory procedures and method that I learned from the soil science. I applied that knowledge to the manure phosphorus here at the dairy at this university. We find the things we find about phosphorus solubility and the how after field application it will dissolve in the rainwater and move with water and potentially get into streams and creeks and stuff. That was really eye-opening and it was very exciting. So the excitement and how it started, it was a whole week conversation. I was talking to this professor who's the dairy nutritionist, and dairy nutrition, he had very little knowledge about phosphorus, and it was just kept asking me, talking in the hallway, and kept asking me, what is the chemical forms of phosphorus in manure? I kept asking me several times with conversation, and eventually I thought, I don't know, so why don't we measure it? So I applied the soil phosphorus fractionation methodology to manure phosphorus, and from there we find the results, the findings, the outcomes was different from what people have been saying about the phosphorus solubility. So we published in scientific papers, and we got grants, and from there we got a lot of support and a lot of more findings. Yeah.
That's incredible. Awesome. The excitement is just really cool. So while we've been chatting and hearing you, we see this red contraption thing behind you, and we'd love to just know, what is that and what is it used for? And maybe just talk about that a little bit.
Yeah, I actually, there is a name for it, but I'm not sure. It's called, there's something, comfort hoof care. I believe this is a tool for the veterinarians. I believe this is what they use to keep the cows stable and do the food trimming. You know, cows are, they are heavy. They are 1,300 to 1,500 pounds. The heavy weight carried has a very heavy bearing on their hoof, on their feet, right, the bottom. So when they stand a lot, right? So yeah, so this was, they called it hoof trimming or something. That's a health measure, a cow wellness measure we take here. So this is the facility to keep the cows steady when they do the procedure. That's all I know. Yeah.
Gotcha. Kind of like a little chute. Like you just kind of like put them in there, and then they can do their feet. That's awesome. Very cool.
Yep.
We weren't sure if it had anything to do with your research or not. That's why we were curious.
Yep.
Awesome. Well, I think we're wrapping up on questions over here. Dr. Du, do you have any other, tidbits or facts or anything fun you'd like to share with us about research or about your sustainability work or anything like that before we wrap up today?
Can you say that again? I got distracted.
We were just wondering if you had anything that you would like to share with us before we jump off for today. If there's anything else you wanted to share about research or sustainability or anything like that before we tune off today.
I just wanted to say everybody drink milk and eat dairy products. I love it. And this is something I was in a very ongoing study, current study, not completed yet, but I can share with you a little bit of that, the importance of milk and dairy products. We're doing this global nutrition security, food and nutrition security study. And North America and the Europeans we calculated 11 essential nutrients that is essential for human health, human nutrition, right? And of these 11 nutrients, vitamin A and calcium are the least adequate or the most deficiency worldwide. But North America and European diets, and this deficit was relatively minor. And the rest of the world really have a severe deficit in calcium and vitamin A. And then we looked at the different food groups and the relationship with this nutrient deficit versus nutrient adequacy. This is for human diet. It was a lot. It has a lot to do with the dairy products, with milk. Yeah. So yes, very important. Calcium.
Components in dairy.
Yes. Big components with dairy. We look at the graphs of the different global region and the food groups and these nutrients, where the calcium and the vitamin A are in the least problem or most highest efficiency adequacy. It's just where the dairy production and the dairy products consumption is the highest. So that's really important. Support dairy.
Yeah, awesome. Well, thank you so much, Dr. Doe, for taking some time today to answer our questions. Your job is clearly crucial as a researcher to learn more about ways that dairy farmers can improve their efficiency and effectiveness in cow comfort, in nutrition, and environmental sustainability. So thank you so much for your time today with us. We really appreciate it.
Thank you. Thank you.
Awesome. All right, so we are going to get ready to wrap up today. Thank you so much. We had a chance to tour Marshak Dairy and learn more about a few different key people that work here in the areas of research, crops and nutrition, and veterinary sciences. And seriously, a huge thank you to the University of Pennsylvania for letting us tour their dairy farm, Marshak Dairy, today. It really has been a wonderful learning experience. In addition, thank you to Joe Bender and Linda Baker for hosting us today for their tour. It was a pleasure learning all about Marshak Dairy and the various careers that go within the dairy and ag industry. And to wrap up today, we are going to launch a Kahoot game to recap what we learned at Marshak Dairy. So we're going to go ahead and play that at kahoot.it. So if you want to go ahead and hop on your mobile device or on a computer and go to kahoot.it, kahoot.it with your computer or mobile device. Go ahead and get that pulled up. We're going to go ahead and play a quick review game to see who was paying attention during all of our chats today. So I'm going to go ahead and share my screen so you have a PIN number to use. Give me a second here to get that up for you. All right. There we go. All right. So here is our PIN. We have 5129356. So go ahead and put that PIN number in if you are going ahead and join in our game here as we wrap up our tour for today. So we'll go ahead and give some players some time to go ahead and put that code in and join the game to do our review game. So again, we're going to kahoot.it on the app or online. And then you're going to go ahead and put that code in 5129356. And we'll give it another minute here. Maybe everyone already hopped off. All right, so it looks like maybe everyone's hopped off for the day already, but we really hope you enjoyed our tour today. So we're going to go ahead and just stop screen sharing here. Thank you so much, everyone, for joining us today. We do have one more tour today in the afternoon if you'd like to join. So come back to the Dairy Excellence Foundation YouTube channel and join Farmer Walt at Walmore Holsteins in Cochranville, Pennsylvania at 1 o'clock. Thanks again, everybody. We loved having you today, and we hope you have a great day. Bye, everybody.